Senator Cassidy.
Thank you, Mr. Chairman. I want to also thank you, begin by thanking you for including in the manager's amendment at our request a prompt pay requirement, considerations for rural access and the determination of geographic regions for the application of the benchmark, and a retrospective review of how the benchmark affects rural areas and healthcare professional shortage areas. All these pertain to the surprise medical billing provision. I'm going to speak specifically to Cassidy Amendment number 3, of which Hassan and Murkowski are on there with me as well. And that also, if you will, addresses some of our concerns regarding the current construct of the surprise medical billing. We just need, let me first set context. Among us who support an alternative way of coming at surprise medical billing, there was a delicate balance struck between insurance companies, hospitals, and doctors. What has been adopted is entirely in the insurance company's interest. I'm a little surprised my colleagues on the other side of the aisle running for president are okay with this. And just to show you why this could be an issue, there is incredible market concentration among insurance companies. The darker the color, turn it this way, please. The darker the color, the greater the consolidation. And so if we allow insurance companies to set the rate without a dispute resolution process, you can look at those dark blue states and see that they will set a rate that just has no appeal. Next slide, please. And this has consequences because some hospitals will go out of business. As you see from this is the closing of rural hospitals, with Texas and Tennessee having the most rural hospitals closed. And this is because bad payer mixes in which you have so much Medicaid, so much Medicare, that the commercial is constrained in terms of what can be charged, they go out of business. Now, this is about patients. It's not about doctors. It's not about hospitals. It's about patients. And again, my concern is the construct for how we are addressing surprise medical billing puts all the power in the insurance companies' hands. And of course, the quote comes from Lord Acton, absolute power corrupts absolutely. Now, you can say there'll be good, believe me, I'm not like Bernie, I'm not bashing big insurance. I just know that there'll be a race to the bottom. If one insurance company decides to do this and lowers rates, then all will have to follow if they wish to stay competitive. Now, there's another aspect to this. If an insurance plan does not put in their provider network accurately, and many don't, people will think their doctor is on the insurance plan, and indeed the doctor is not. So what this amendment does, and we worked this out with the committee staff, would require in a kind of real-time basis, the insurance plans to at least post who is in network based upon their last interaction. Ideally, this would then be taken by app developers and something be put on a phone, and then someone can see, yes, this doctor or this hospital is in network or is not in network. Now, I think it's not as good as it should be, but obviously, and I thank the chairman because he has offered to work between now and floor consideration on how we are doing the surprise medical billing. But I would ask support of this because otherwise there's almost absolutely no protection for the doctors and the hospitals and therefore the patients, if in my opinion, under the way this is currently constructed, this begins to give some protections in that regard. So I'd ask your support for Cassidy, Hassan, and Murkowski Amendment number 3.
Thank you, Senator Cassidy, and I'm going to go to Senator Hassan and Smith in a minute, but first I want to thank Senator Cassidy, Hassan, and Murkowski for their work on surprise medical billing. As I said earlier, they lit a fire on the subject months ago, focused attention on it. We are still working on it, and Senator Cassidy is exactly right. We've agreed there will be an amendment which he's offering today, which I support, which changes